Hello again, everybody. Welcome to Good to Know Shreveport Bossier. This is our podcast showcasing all the fun, good, positive things happening around our community. My name is Jeff Beimfohr. Over here to my right is my co-host Paul Reiser, member of the Committee of 100. And every podcast we focus on topics and initiatives having positive impacts on our community. We have new episodes available every other Wednesday, and you can find Good to Know wherever you listen to your podcast. So as always, do the honors.
Well, thank you, Jeff. Man, that was just short and friendly today.
Yeah, it was a late night, so.
I appreciate it. Hey, today, no exception. We got another good one.
None whatsoever. No exception.
No exception. Okay. So I'm sure you're familiar with LSU Health Medical School here here in Shreveport.
I am.
So it's a big impact on our community. So today we have the Chancellor from LSU that's going to be here to talk to us. And I've got this guy's esteemed. So I have actually written down some of the things because I don't want to get this wrong. His name is Dr. David.
As per normal,
Guzick,
you mean? Go ahead, say his
as
name
I usually
again.
mess up.
Yeah.
No, but this is going to take a minute because not just because I'm slow at introducing people.
Well, that is the norm, yes.
But he is so accomplished. This is going to take just a second.
All right.
All right.
You'll notice that these intros last forever here.
People need to know.
I'm already impressed.
That we got somebody. You're already impressed. Look at this. We've impressed the doctor. So Dr. Guzick received his MD and PhD in economics from New York University. PhD in economics. So he's a doctor and an economist.
Okay, I'm impressed.
Okay.
Keep going.
He's
Try to pick up the pace a little, though.
Clinician, medical scientist, and health economist. So he was awarded the Best Physician for Women recognition by Good Housekeeping. He's a recipient of the Roy M. Pitkin Award for the best paper published in the journal Obstetrics and Gynecology. He earned top paper of the decade in reproductive medicine from the Serrano Symposium. He might have to clear me up on that one. International Foundation. He's an author. His 2020 book entitled U.S. Healthcare Industry, Balancing Care, Cost, and Access was published by Johns Hopkins Press, and it captures his interest in health, economics, and public health.
You're right. He has a few accomplishments.
And that's just scratching the surface. But we're going to hear from the doctor himself. So, Dr. David Guzick, thanks for coming out, man. Welcome to the show.
Pleasure to be here. Pleasure to be in Shreveport.
Were you impressed with the way he did that?
You picked out some things that people normally don't notice. So thank you.
Well, people talk about you're the Chancellor, and we're excited to have you here from New York and Florida and all over the world. But you look at some of these things that are really stand out that make you, I think, very unique. And now I understand why it's taken us over a year to get with your schedule to where you could be on our show, because darn, you're a busy guy.
Well, we're trying to get some good things done over there, and it takes a little effort. But I'm sorry that couldn't be here earlier.
Well, look, we were talking in the hallway as we were walking into the studio about how LSU Health is a separate entity from Ochsner, from LSU. So explain all of that.
Yeah, it's confusing, and we do have an identity problem, so we're trying to clarify that.
Yes.
There is an entity called Ochsner Health, which sits mainly in New Orleans. It has many hospitals across the state, headquartered in New Orleans. There's an entity called LSU, headquartered in Baton Rouge, of which there's a medical school and allied health school and school of graduate studies here on the LSU Health Shreveport campus. And then there is an entity that sort of sounds like it could be Ochsner, it could be LSU, but it's actually neither. It's a separate entity called Ochsner LSU Health System. And that partnership was created in 2018. And it is 50% LSU and 50% Ochsner, but it's a separate legal entity. So it's a mouthful, Ochsner LSU Health System, OLHS. Mm-hmm. And that is the entity that combines the doctors of the LSU Medical School and the hospital and outpatient clinics of this joint entity into the clinical enterprise that we call Ochsner LSU Health System. That thing intersects with the LSU Health Medical School, because the doctors of the medical school provide the care in the hospitals and outpatient clinics of that system. So overall, we have 3 hospitals in our system. We have the main hospital on Kings Highway. We have St. Mary, which opened during the middle of COVID and now has the most deliveries in the entire community.
Wow.
It's a women's and children's hospital mainly, but we have a surgery center there where orthopedics does surgery and other specialties do outpatient surgery. And then we have a hospital in Monroe as well. So those three entities form this LSU Oxnard Health System. And then, of course, we have the medical school and the allied health and the graduate study. So altogether, we're forming the only academic health center in a 250-mile radius. You have to go to Dallas to get one. You have to go to Little Rock to the north, Jackson, Mississippi to the east. We're it. So the reason I'm here and what I found attractive is that this entire North Louisiana area did not have an academic health center. And so we're building it by combining this partnership that I mentioned with the LSU Health Shreveport.
Just curious, wouldn't it have been maybe a little simpler to change the name altogether so that people weren't confused?
Yeah, I guess. Well, back in 2018, that they were forging this relationship, and at the time they thought it combined both names, and it made sense then. But maybe you're right. Maybe we need a very shorter name. I mean, a little more pithy. Absolutely.
A little more pithy. Jeff, people say that all the time, don't they? Maybe you're right.
To me, no, never.
Yeah, what did attract you to come here? Because I know you've been all over the country. Last year you were in Florida. You've been here for about a year and a half.
Yeah.
So what brought you to Shreveport?
Well, so going back even before Florida, I was the dean of the medical school at the University of Rochester. And from there, I went to Florida to have in a leadership role where I was responsible for the medical school, but there were 5 other health science colleges: pharmacy, nursing, etc., public health, veterinary medicine, dentistry, but also the hospital system. So I put that together. It was very successful.
That was Rochester, New York?
Rochester,
Minnesota.
New York.
New York.
Rochester, Minnesota. You know something about the healthcare. So that's the world of Mayo Clinic.
Yeah.
Rochester, Minnesota. It's probably other Rochesters in the country, but one is in Minnesota, the Mayo Clinic. University of Rochester is the major health system for upstate, for Western New York, basically. But then I saw this opportunity here, and frankly, it's an opportunity to make a difference in a community and in a region where there are significant health problems. You may know all the public health metrics, whichever ones you want to measure, infant mortality, life expectancy, etc., are among the worst in the country. So it's an opportunity to try to help that and to build this academic health center that doesn't exist.
Well, something that's so interesting to me is your interest in medicine and economics. So what brings those two together in your mind, and what are you doing to bring those two things together here in North Louisiana?
So, we have a paradox in this country because we spend twice as much per person as other developed countries in the world, on average, roughly twice as much per person.
Wow.
And yet we have the worst outcomes, right? It's not.
Are the outcomes, they're the worst?
If you look at the peer countries, say the top 10 or 15 peer countries measured by GDP per capita, so you're roughly in the same level of economic development, and you look at the ones I mentioned: life expectancy, infant mortality, the likelihood of having a chronic medical condition that's behaviorally based. Yeah, we're at the bottom of the list on virtually all of those things.
I think that's shocking to people because
that's
everyone's
disappointing
like, America,
too.
We're the healthiest. We're supposed to be the best. And why is that? What is the situation?
Because we put too much junk in our bodies?
Hey. Free choice.
Like Sonic?
Did I
say that out loud?
I knew you were going there.
So it's a challenge for us.
Fault.
We spend a lot of money on healthcare. We have one out of every $5 in the economy is spent on healthcare, and that's also 50 to 100% more on a GDP basis than the other developed countries. And so for many individuals, if you have access to the best quality healthcare, it's the best in the world, right? Now you still have behavioral issues that lead you to be in that hospital to begin with that might be at a higher rate than in other countries, but we have the best medical care in the world, but we also have a problem with access for a large part of the population, where they don't do as well. And so it's not as homogeneous with respect to the population.
So it's concentrated in certain areas, and that's why you're here to kind of spread it out to this area.
We're here to try to take care of everybody and to try to improve health care and health.
So what are some things, you've been here a year and a half,
right,
and you're one, from what I understand, changed the perception and the actual activity of the hospital and the school. So what are some changes that have happened, and how's that going right now?
Yeah, so I can just briefly summarize. We have the three missions. We have education, we have research, we have patient care. So starting with education, in the medical school world, there was, I'll just call it a very traditional staid curriculum, which was based on 2 years of being in lectures and learning about the scientific underpinnings of medicine, and then 2 years being on the wards. Basically we just completely overhauled that. So what we now have is, instead of a lot of lectures, we have small group learning. It's something called a flipped classroom, where the students are given material to read before they come in, and then instead of being lectured to, they teach each other in small groups.
Oh, wow.
Where they're given problems to solve based on what they presumably would have learned the night before. And so the education system that we've put into place, this was, when I first got here, we hired a new Associate Dean for Medical Education who's doing much of that, Dr. Kelly Pagitas. And the student satisfaction scores have really zoomed way up. Their scores on the standardized exams have zoomed way up. So that's one of the things we've done.
Well, that's cool. I mean, that would be surprising. You're having students teach students, but yet their scores are going up. Is that because you learn better when you're learning to teach?
Yeah, you go. It's called active learning as opposed to passive learning. And when you learn active learning, when you're teaching each other, you actually learn better. With respect to research, we could have great educational program and we could have great healthcare delivery, but the stature of a medical center is really very highly correlated with the amount of research, and NIH funded research in particular. So we've really made a tremendous effort to expand our research program and to recruit people in to Shreveport from outside of Shreveport, because when they come in, families come in, they have to buy a home, they have to get a mortgage, they have to go to the grocery store. We've already increased the amount of research by probably 25%, but we're going to actually have an explosion coming in. We have literally at the moment, we're recruiting 10 or 12 different individuals from around the country. And I can mention one thing that we're very excited about, because we're running out of research space, because we're doing this recruiting, and that had begun for a couple of years prior to this, which is that we now are doing due diligence on the Sears building that is in the mall, opposite the other anchor besides Dillard's, that's now been sitting there empty for 5 or 6 years when all the Steers went bankrupt across the country. We're going to turn that into a research lab.
Nice.
And
so that's interesting. So we think of medical schools as they're coming to learn how to take care of people, but you're also doing research, and you're really stressing and growing the research aspect of the school.
Medical schools are judged, as I said, really by the amount of research that's done and the impact of that research, which is measured by the quality of the journals that the scientists publish in, and the dollars of grant support coming in. And it really can create, if it works well, this academic health center that I mentioned, where there's a positive feedback loop between the patient care, the education, and the research. It can create economic development, and this Sears project is one example. We are doing due diligence. We haven't closed on it yet, but we
close enough you can mention
we're
it.
Close enough that I asked whether we could mention it, and the answer was yes, please mention it.
Yeah.
So unless there's something weird that happens in the due diligence, in a few weeks we'll be the proud owners of that Sears facility. Nice. It's about 160,000 square feet. It's beautiful for lab space, because basically when you look inside in any of the department stores, you have high ceilings, you have basically some pillars, but otherwise it's open space.
Is this a scoop? Is this the first time this is getting?
The first time
right here.
Broken right here.
Good to know
Shreveport Bossier.
And I mean, that's the economic development that I was talking about. So your school is bringing physicians in. Hopefully you guys are getting physicians to come and stay. Instructors, students.
So since the partnership started, and this wasn't in the last year and a half, but since the partnership started, we've actually more than doubled the number of doctors, clinicians on the faculty who are MD clinicians from about low 200s to about 500 clinical
that's
faculty.
Quite
so that's a doubling or more than doubling of the numbers of doctors. And the previous dean, Dr. David Lewis, was very much responsible for that over the years since 2018, and we're continuing that. But on the science side, as I said, we're also recruiting, and we're running out of research space. And another important thing about this project is it doesn't use a single dollar from the state. What I learned—
That's nice.
Yeah. It is nice.
Yeah.
That's rare.
Is nice. So what I learned is that the mentality, or the mindset was, if you don't get state capital outlay dollars, you don't build anything if you're part of the university system. And we're trying to break that mold. Coming from a private sector background, the University of Rochester, it's a private university. If we had to build a building, it was a combination of philanthropy and bonding. And that's exactly what we're doing here. We're going to raise money. It's going to be probably a cancer and cardiovascular science building. So we're going to raise money around that, and then we're going to bond the rest. And there's something called indirect cost recovery that comes with grants. It's the overhead from grants, and we're going to use that to pay off the principal and interest on the bond. So that's where the economics comes in.
I like it.
Because like 40% of the state budget right now is health department, right?
Well, it could be. You know that better than I do.
Well,
but it's
trust me,
I wouldn't be surprised if it's a very large percentage.
Well, I would ask you one more question. I'm going to get out of Jeff's way because he's like, why do you always just talk, Paul? Because before this, when
it's amazing how you read my mind.
we were talking about restaurants because the Sonics, and when you started talking about
Danny Meyer,
book, Danny Meyer, both of our favorite, well, I don't know if it's your favorite book, one of my favorite books, Setting the Table, about hospitality in the restaurant business. So talk about hospitality, why you study that, and what that means here locally.
Yeah, I was on, so I remember reading that book. I was on a plane during Christmas going home, and it struck me that hospitality in the restaurant business, which was the business that Danny Meyer was in, and this is before he did Shake Shack, this is when he still had fine dining in Manhattan, is very much like hospitality in hospitals. And I looked into it, and it turns out that hotel and hospital and hospitality have the same Latin root. And when you think about the patient experience, you may come in through an ED, or you may be electively admitted and you go into an operating room and you're asleep and you come out, and all you know is, you had some operation. You assume that everything went well. You come out, and you don't really know about the expertise, really, of the different people who were working on you because you were asleep. But when you come out, you're in a hotel room equivalent. You're dealing with people, and you can assess how well you're taken care of. What the relationship is in the communication between the different folks taking care of you, the doctors and the nurses and the others on the healthcare team, and how they relate to you. All of that is very much analogous to what Danny Myers was writing about in hospitality. So that, in terms of the quality of healthcare, there are things you can measure that patients don't know much about that have to do with the scientific underpinnings and the clinical skill, but then there's a whole host of things that that patients very easily can express a satisfaction.
You don't
i.e. hospital food.
Yeah, hospital food is one.
You get a good price at the hospital food, man. It's a good place. So
really, you want to check out my latest hospital bill?
Just in the cafeteria.
Yeah. Oh, okay. Well, I'm talking about when you're in the patient. I'm interested in something you've mentioned a couple times.
Yeah.
And that is that the medical schools are graded on their research.
Yeah.
As most people, including me, would think they would be graded on how well they treat the patient. That's what I would think. But
so there are different grading systems, and you can argue that one might be better than the other.
No, I'm just a dummy.
But the main grading system for medical schools is like any other university. It goes to U.S. News ranking.
Okay.
And most people, if you have a kid that's gone to college or applying to college, you're familiar with the U.S. News rankings because they don't go to college. You may have looked at that. Medical schools have those too. And when you look at the medical school rankings, there are a number of things that they include. Peer evaluation would be one. They send surveys out to the deans of the medical schools and they say, what do you think about these 100 medical schools? 1 to 5 Likert scale. You have the medical college admission test scores of the students. That's another thing that's in there, and so on. But then there's this thing, NIH funding. And if you look at and peer evaluation, if you're a dean and you're evaluating other schools, that's what's in your head. Is this a high or medium or low NIH thing? And you sort of know that, but you also have a fine-grained listing of that. So the peer evaluation, which is weighted heavily, is correlated with the NIH funding. And then the overall evaluation is very highly correlated. So it might seem like counterintuitive, but how do you measure how well the doctors are taking care of patients really? As a medical school, it's more education-based and it's more research-based than it is patient care-based, because that's a separate rating system in the hospitals.
All right, interesting.
Yeah.
It's kind of how I grade Sonic him. It's against your peers.
We used to get Mr. Yeah, that's right. Where are you going to pull in?
Yeah.
So, golly, there's so many things. There's something about the development. We had talked about you talked about the Sears probably happening. Don't you also have another $79 million building?
Oh, well, I'm glad you
just
mentioned
happened
that.
to throw that. Just happened.
So we just opened depending on your count, roughly $80 million building, 155,000.
Call me a liar for $1 million. I got you.
And it's a
for a lot less.
It's an architecturally modern building. We hope to really make it a community resource because there's a large auditorium in the building. We hope to open that up to events.
Oh, I'm sorry, I didn't really describe. So what is the building and where is it?
The building is on the campus, right on Kings Highway. It's not abutting Kings Highway. It's a bit interior, but there's a driveway off of Kings Highway right before you get to the hospital where you can go in. And it's a building for the students, mainly the medical students, but there's some participation of the allied health students there as well. And we had a medical school building that really hadn't changed much since it was built. It opened in 1974, I guess, was the first graduating class of the medical school.
Wow.
So, as I mentioned before, the curriculum has changed over the years, but you need new space, you need form meeting functions, so you need new space to meet the new curriculum. You need these small group learning rooms. There's a basketball court there. There's a fitness center, so that you have, I was there this morning, you have strength and fitness floor, and then above that, cardiovascular floor overlooking the basketball court.
Wow.
You'll find a lot of students there, good for their mental health. So we have a wellness component. In terms of hospital cafeteria food, you're right, you're absolutely right. So for the students and for the staff, we have brought in the same vendor, the same caterer, that caters the athlete food service at LSU Baton Rouge.
Oh, wow.
So they're going to come in and they're going to have a higher level culinary offerings.
I want to come and eat there from now on.
Culinary offerings. And we're back to Danny Meyer.
Yeah.
That's got to be great for attracting students.
That's in the building.
And staff.
Yeah, that's great.
And then again, simulation rooms. So in other words, before the medical students actually work on quote unquote real patients, there are simulation types of activities that they can participate in and learn from. So that's great. And then in addition to that, there's a floor of laboratories on the top of the building, which one aspect of which is called biosafety level 3 laboratory, which is a containment facility for viruses like coronavirus. So we can study these viruses and other pathogens that require special containment facilities, and that's part of the NIH funding and part of the emergency preparedness funding and so on that we'll be able to participate in. And there are only, of the particular type that we have, I think there's only maybe 20 or so such facilities in the country.
And all of this stuff taken as a whole just sounds amazing.
Yeah, well, we think it's pretty amazing. And the Sears is right around the corner. And hopefully the Sears will vitalize the mall because parts of it are not doing so well.
Yeah, that would be good. So how does the, all of it, around the Shreveport Bossier area, all of the medical stuff you're talking about, how do we rank, I guess, in the country?
Louisiana as a whole doesn't rank that well.
No, I know the state, but I just mean what you're doing.
What we're doing, you have to measure in different ways. So one thing we're very proud of is St. Mary, which I mentioned, which is part of our world, is a Leapfrog A ranked hospital. We're very proud of that. It's the only one in North Louisiana. So in that regard, we're doing very well. When you look at certain studies that we're doing in terms of the ability to recruit patients, and in particular African American patients, because those are underrepresented in a lot of research. So Shreveport is an area where many of those patients can be recruited. We rank very, very highly as far as the rates of recruitment, for example. In certain areas of research, in cardiovascular research, neuroscience research, immunology and virology research, we rank highly. We want to rank more highly in cancer, for example. We want to rank more highly in clinical research, all those things I mentioned as laboratory. So those are more aspirational. So that's some of the rankings.
Well, I'm easily impressed, but this all sounds pretty darn impressive to me.
Well,
so we're on the upswing, I would say then.
And the motto that I've adopted is aiming high, because Shreveport sometimes can have a chip on its shoulder. In fact, LSU as a whole, the President Tate talks about the fact that we're known for excellence in athletics, but not in academics, and he uses the phrase pursuing excellence in all we do, not only athletics. So I kind of shortened that to aiming high, and it kind of points to what you were saying. So how are we doing here? And the answer is not as well as we should, but we want to aim high, because if you have the attitude that you can't achieve much with little Shreveport, not much can happen on a national scale. We're trying to prove that wrong.
All these projects that you were talking about a little bit ago, any timeline for all of these things going on?
Well, the great thing about the Sears project, for example, is that we get to work on that right away. So as soon as we close, which is hopefully in a few weeks, we immediately put a bid out to get an architect in. The laboratories have special codes that has to, it's a specialized type of architect that builds those things. So we go with that. If we had to go through the state to get state funding, it's first a political process to even get on the list. It's another political process to get high enough on the list that you're going to be in line for funding. And then you have to hope that the year that you're in line for funding, there's funding available.
Wow.
And then even after everything is said and done, you then have state agencies to deal with, which are not as facile, not as, not as quick on the ability to build and building as we can. So we're hoping, and I'm saying this without knowledge of speaking to any contractors, that we're looking at 18 months to 2 years to do this whole project, as opposed to many years.
Yeah, sure.
Yeah, well, I get what you're saying, because I cover politics for the station here.
But you have a chance.
I completely understand what you're talking about.
You have a chance to get started pretty soon then, and then it just comes down to because of the way you've been creative and you're fine. Don't have to wait for all this.
We are not using a dollar of state money.
That's awesome.
And we have our foundation has purchased the building. The foundation will issue bonds through a conduit facility in the state, but not related to legislative, not related to the university, and then we just pay the principal and interest on the bonds, and it's done.
We got like 2 minutes.
So what does the future hold? What are some things you're looking forward to? Are you gonna stick around for a while?
I'm definitely going to stick around for a while because we're doing this exciting work. So the future is recruiting. It's recruiting doctors, recruiting scientists, and growing. That's the future.
Great. I love hearing about all your projects.
Yeah.
And I'm going to get to our assignment desk, and we'll be contacting you to talk about them, okay?
All right, terrific. That sounds great.
Dr. David Guzick,
Yeah.
is that the correct pronunciation?
Yeah.
Guzick, all right. From LSU Health
Shreveport.
LSU Health Shreveport, as opposed to all those other entities.
Right.
You've been watching Good to Know Shreveport Bossier. You can get it on all the major platforms. Have a good time. Thanks for being here. And as always, it's been good to know.